Bienvenidos al Medical Spanish Podcast. Soy la doctora Molly Merton. Through this podcast, I provide interactive audio lessons that teach practical Spanish for healthcare and elsewhere. Welcome to our first audio lesson covering Spanish for COPD, or chronic obstructive pulmonary disease. We have already covered Spanish for respiratory symptoms, smoking history, and inhaler use in prior lessons, so I will leave links to these lessons in the show notes. In this series on COPD, we are going to focus on patient education. In doing this, we will cover a lot of really useful vocabulary and phrases for the medical setting. In this first audio lesson on COPD, you will hear COPD explained in Spanish and how it differs from asthma. In upcoming audio lessons, the doctor will discuss the causes of COPD, the importance of smoking cessation, pulmonary function tests, oxygen monitoring, screening for lung cancer, oxygen therapy, and pulmonary rehabilitation. Several members have requested I cover COPD, so when Dr. Yaron Goldman, a pulmonologist and member at DocMolly.com, offered to provide input, I jumped at the opportunity. Dr. Goldman shared what he felt was essential information during a clinic visit for a patient with a new diagnosis of COPD. Shout out to Dr. Goldman for his collaboration on this audio series covering Spanish for COPD. I would also like to thank Angel Baena, a Spanish language teacher from Mexico, who just completed his training as an ICU nurse. Angel helped with the Spanish for this dialogue, and he plays the role of the doctor. With Angel's background in both Spanish instruction and nursing, he is an excellent resource for learning medical Spanish. Angel provides one-on-one lessons over Skype. Check out the link in your show notes to request information from Angel about his lessons. Now let's listen to the dialogue. In this dialogue, you will hear the doctor explain how chronic obstructive pulmonary disease can lead to two types of problems: chronic bronchitis, which causes airway inflammation and a persistent cough, and emphysema, which makes it difficult to breathe and get enough oxygen. He explains that the patient suffers from a combination of these two problems. As is often the case, the patient was previously diagnosed with asthma, and she assumes that that is what she has. The doctor then goes on to explain the difference between asthma and COPD. As you listen, try to pick up the Spanish words for COPD, airways, wheezing, and oxygen. There will be a brief quiz at the end. Empecemos. The lessons offered at DocMolly.com are solely for learning Spanish. They are not intended to teach medicine or provide medical advice. The level of this lesson is advanced.
Usted tiene algo que se llama la enfermedad pulmonar obstructiva crónica, también conocida como la EPOC. Esta enfermedad puede llevar a dos tipos de problemas. El primer problema se llama la bronquitis crónica y ocurre cuando hay mucha inflamación en las vías respiratorias. Esta inflamación causa una tos persistente con mucha flema, sibilancias, que es como un silbido que se oye al respirar, y dificultad para respirar también. El segundo problema se llama la enfisema y ocurre cuando los alvéolos, o sea, las bolsitas de aire en los pulmones, se dañan. Esto hace que sea difícil respirar y recibir el oxígeno que usted necesita.
Entonces, yo debo de tener enfisema. Mi papá tenía enfisema.
Usted sufre de una combinación de estos dos problemas: la bronquitis crónica, que causa la tos con flema, y la enfisema, que dificulta la respiración.
¿Y esta enfermedad, la EPOC, es como el asma? Porque ya me diagnosticaron asma.
El asma suele aparecer en la juventud por causa de alergias. Generalmente se puede revertir la inflamación y el estrechamiento de las vías respiratorias que se dan en el asma con tratamiento. A diferencia del asma, la enfermedad pulmonar obstructiva crónica es progresiva, lo cual significa que aún con tratamiento la función de los pulmones empeora con el tiempo.
Bueno, doctor, me parece que ya es hora para dejar de fumar. And she's right. It's time to quit smoking. Ya es hora de dejar de fumar. In the upcoming lessons, the doctor will discuss the importance of smoking cessation and how they are going to monitor and treat her COPD. So now for a brief audio quiz. Do you remember how to say COPD in Spanish? La EPOC. And we use the article la before EPOC because we are referring to la enfermedad pulmonar obstructiva crónica. So how do you say airways in Spanish? Las vías respiratorias. Wheezing. Las sibilancias. And the doctor describes las sibilancias como un silbido que se oye al respirar, a whistle heard when you breathe. Finally, how do you say oxygen in Spanish? El oxígeno. Muy bien. Now, if you want to go through all the key vocabulary from this dialogue and then put that vocabulary to use as you interpret the entire dialogue between English and Spanish, go to docmolly.com and sign up to become a premium member. The premium audio lessons covering Spanish for COPD will be available under the Medical Spanish membership. Eso es todo por hoy. I'll be back soon with our next lesson covering Spanish for COPD. Hasta pronto! This is a production of DocMolly.com, where you will find interactive audio lessons that teach Spanish for healthcare and elsewhere.